Got an opportunity to meet another one of my colleagues, teammates, supervisor, Ms. Morales. She did a fantastic job from a community engagement perspective as well. Today, you're going to meet the rest of the engagement team. Community engagement is something that has a lot of definitions. I'll get into that later on after the other teammates introduce themselves. But in general, our team is like boots on the ground when it comes to community engagement. When the patients program decides to partner with a researcher, principal investigator, or we have a project in hand, we are the ones that go out into the community and meet and greet and engage the community where they are. So you'll see the patients program table, or you'll see BJ and I out with a backpack, or you'll see a day setting up a table at your local health fairs, some church give backs, school season is upon us right now, so you'll see us out and about in the Baltimore community at our back to school events. If you had the opportunity to see something on Facebook recently, our social media efforts with Real Talk with Rodney and BJ's Corner, we're always trying to find a way to engage the community and meet them where they are. Um, Dealing with the pandemic, the social media efforts kind of taught us that we still need to stay connected, and it was a huge success for us to carry on the work that we do, talk about the projects that we do, the relationships that we've built over time. So, being part of the engagement team literally gives you an opportunity to tap into that other side of research that I'm not going to say people don't want to get their hands dirty, but hey, we are literally out there, out and about in the community, touching these community members, touching these stakeholders, sharing the opportunity for community members to have a seat at the table when it comes to research, improving their health. And from the lens or the side or the other side of the bridge where the researchers are, we understand that they need numbers and they need people to get their research to float. But you have to learn that process. You have to learn how to engage the community. Each community is different, different ways to do it, to go about it. But have an opportunity to have a seat at the table and learn from each other is something that the patients program in general does. But the engagement team, we find ways to connect with those folks out and about in the community. So again, 5 years experience, have learned so much from my colleagues, teammates, team members, but also people out in the community. I'll share a little bit about what we're going to talk about later on after the rest of my team introduces themselves. But just like Joe said, if you guys have any questions or comments, don't hesitate dropping them in the comment section and we'll get to them as we go along. Next up, I want to introduce next member of the patients team, Ade. You mind go ahead and sharing yourself, Ade?
Hi everyone. Hi everyone. My name is Adebukola Oluyole. You can call me Ade, and I'm also an engagement program specialist here with the Patients Program. My background is in public health with a concentration in social behavior and community health, and I've also been with the Patients Program for just under a year. But I've been in and out of roles that have given me the opportunity to engage in community work for about 4 years. One of the reasons why I enjoy being out in the community is because I enjoy connecting with people. Engaging and outreach allows us to share knowledge and resources, but it also allows us to make a positive impact in the community. So I'm happy to be here and to share some of my experiences with you guys, especially about the admin side of community engagement.
BJ, you want to go next? Introduce yourself.
Thank you. I want to say hello to everyone. And this is such an honor for me to be able to share 50 or more years of what it means to be a true community. Thank you, Dr. Mullins, a true community advocate. First and foremost, I love, thanks, Storm, I love what I do. When you have something that you do that you love, you'll always be good at it. And when we are talking about what we do, why we do it, you nurture, you grow, but you grow with everybody, just like your sister and brother. And people begin to understand you, you understand them, and often you don't have to say anything, you connect. And I know that the Patients Program, I've been with this long before it was called that, has grown. And it is just such an honor to hear all your questions. And whatever it is, no question is too small to ask, because somebody else may want to ask it, but they don't know how. So ask your questions. I will give you the answer. If I don't know, my rule is this: I'll find somebody who does. Rodney?
Thank you, BJ. That was perfect. That was awesome. Thank you, Day, as well. To get us started, just want to give a kind of a brief definition of what community engagement is. There are tons of definitions out there online at different organizations. I found one that kind of, for me, I think will hit the conversation. Will get us started in the conversation we hear today. It's from the Penn State College of Agricultural Science website, and they state that community engagement seeks to better engage the community to achieve long-term and sustainable outcomes, processes, relationships, discourse, decision-making, and or implementation. To me, I think that definition covers a lot when it comes to community engagement, because there is no one definition for it. It doesn't match every community. We're here in Baltimore, Maryland, and particularly the west side of Baltimore. We do a lot of engagement out in the community, and this community is very unique. And you can't go to one block or one group or one organization with the same approach that you went with the next one that's literally 2-3 blocks away, or the organization that's a mile away. So you have to find ways to stay connected to those community members, but in a genuine way, though, right? Because it's not a one-stop shop. You don't want to just go to them for one event or engage with them one time and then that's it. I'll talk a little bit later about the definition of helicopter research in our conversation, but that's the terminology that we know here in Baltimore all too well. BJ, I want to get the conversation started and talk to you about, or get you an actual question about, how can community engagement be successful, right? We know what it is. You want to seek to engage community to achieve a long-term and sustainable outcomes. How can we give advice to folks who are tuning in right now? How can we make that successful?
First of all, know your people. That is the most important thing, especially when you're doing research. I've been at this, in which I didn't say earlier, I've been at this for over 50 years, and I am still growing, but I listen to my community. I'll ask them, what is it that you want? Because when they tell me what they want, they are telling me what the benefits are to them. I actually am concerned that we give back to them what it is that they need. And a lot of times people do not often have that. A lot of it is just understanding and letting your people understand you. You've been around me and Karen and Ade and, and Dr. Mullins. I could walk into an open room and 4 or 5 people will run to me and grab me and hug me. That is that love of, we know you, we understand you. I am a person that I don't come at them as their nurse or as their researcher, but they will say, what are you doing? Or Miss BJ, my mother is sick, or I've got this sore. They trust me enough. And that's what we want in whatever it is, that trust and transparency.
Yeah, exactly. I'm sorry,
Never
BJ.
lie to a person in the community, because they know when you're lying.
Yeah, the
And
community
it's in
definitely
their
has.
face.
The community definitely has their instincts up when we come into the community, and can tell when it's not authentic or when it's not real or when it's one-sided. I think that's more than anything. We talk a lot about here in Baltimore, or in this space in general, about helicopter research and not participating in helicopter research. That is one way that you can assure that, or be on the right path to your engagement being successful. For those of you who don't know, or not from the Baltimore area, here in Baltimore inner city, sometimes when we see the helicopters flying over the community, we know that they're looking for something or someone, right? And if you imagine a helicopter flying over the city and they see what they want and they literally come down and swoop and get what they want and they get back up out of there.
What do you want to do?
That's something that, you know what, isn't something that helps build that sustainable relationship. So the patients program knows that we can't go into BJ's community right now over there in West Baltimore with a one-sided idea or one-sided approach. We can't do that. And I'm pretty sure that's the same thing for Ade that she's experienced so far here with the patients program, but even in New York in her experiences. So Ade, my question will go to you. Can you talk to us a little bit about how there's some similarities or maybe some differences in your experience that you've had here with Baltimore and your experiences in New York when it comes to being authentic and not participating in helicopter research?
So I would say, honestly, like you mentioned earlier with community engagement, it's different, but it's also the same everywhere you go. You just have to really know your community. So in New York, it's the same thing as here, but we do some things that are different, which I was going to bring up when we talk a little bit more about the admin side of things, but I can talk about it right now. So knowing your community, definitely important, but also giving back and connecting with your community. So in New York, some of the roles I did, we really wouldn't reach out after the fact. But here in Baltimore, working with the patients program, one thing that we do different that I think is awesome is thanking that community member for stopping by at our table. So connecting back with them, sending them a thank you email, just saying, hey, thank you so much for stopping at our table. Here are some additional resources, maybe even pointing out something that they talked about when they stopped at our table. Those are the things that are different that I think it's a plus. Also reaching back out to the event coordinator that we connected with early on, just saying, you know, thank you so much for inviting us to your event. We enjoyed meeting the community. Please keep us in mind for future events. And just checking back in here and there, like, oh, hey, Miss Janice, do you have anything coming up? We're looking for some opportunity to do some vending options. So I think those are the pluses here. Whereas in New York, a lot of times it would be like, okay, I'm going to this event and then that's that. Like, there's nothing else. There's no other event. There's nothing wrong with that. I think it just depends what the project is that you're working on. It also depends on the organization you're working with. So having another thing I was going to touch on is having an engagement plan is super important, which is something that we do here that we didn't really do a lot of in New York. And we can talk more about that a little later.
Thank you, Ade. Thank you, BJ, for sure. And that's definitely what that. Oh, my mic is on. Thank you, Ade, and thank you, BJ. That's part of that definition that I mentioned to you earlier about how you sustain those relationships. How do you build those relationships? Because doing anything one-sided isn't going to get the numbers that we need for the project or the interactions that we need for the project, or to be quite honest, give the community members opportunity to share their lived experiences. That's what we try to do a lot here at the Patients Program, particularly with the engagement team. When we go out to, for example, a senior home, or we go out to a health fair, we want to introduce ourselves, introduce the program, if we have any projects that they could be interested in. And then once we get an opportunity to meet with them, whether it's a town hall meeting or whether it's a focus group that could be located in, you know, a nursing home, or it could be located in, a senior home, or maybe a library. Those are places where we get down to the nitty gritty. That's where we get down to exactly what we're there for. So for me, having an opportunity to be engaged in the community, have an opportunity to meet the community where they are, have an opportunity to learn from some of the things that Ade shared with us from New York, not to do, that wasn't successful there, that was successful there, that helps us engage our community and keep them aware of the opportunities that we have, but also give them opportunities again to connect with us, connect with our principal investigators, all in order for the project to be a successful project. So I guess that leads me to we have questions in the comment section.
Yes, the first one was, how do you build capacity of community members?
BJ, that's a great question. You want to take that one first, BJ? And I can hop.
Yes.
I can ask.
Oh, yes, I will. The question should be, BJ, how did you build 50 years of community capacity? One step at a time, love, being honest, and letting people know that I am there for them. As I said, I can walk into a room. I don't have to say, I am BJ Shaneman and I'm from the Patients Program. That's BJ. That's on a one-on-one. We're like sisters and brothers. But they know too, they can come to me and talk to me about anything, whether we're talking research or healthcare. I think everybody saw my note. My client was like at the door with the finger. He needed to, to stop and talk to me. And he was not going to go away. Those are the kind of things of capacity building that you get. No matter what, they will sit and wait because they know that it is important in their benefit. And whatever they want, I will make sure that we can provide it. I hope that
BJ, would you talk a little bit about your grant writing classes?
Oh, yes. I teach a free grant writing class, a $1,500 class, 6 weeks on and 6 weeks off. This is to bring entrepreneurship to the West Baltimore and other areas. I have classes where I could have 100% churches. I can have classes where I have people out of Reston, Virginia, Philadelphia that come down on Tuesday. I've been doing this for over 15 years, but they come down, the class starts at 6, it's over at 7:30, and they learn, first of all, what is a proposal. Most of them come, yep, I want to write a grant, thousands of dollars, and have no idea what a 501c3 is. So sometimes you got to start at the ground and give them that time. And most of my classes, the students will say, would you give us 2 extra classes after, once we go through it? Because they have the interest. They know it's their benefit. And when they come in, they bring somebody who is going to be working with them. The pastors come and they will bring half their church so that everybody will hear. My old saying is this: bring somebody with you so what this horse mouth says, everybody understands it together. And because of that, because of the time that is given to them, no matter what, they are there for you. I did a class the other Tuesday, and the class was over, but the students was standing out in the courtyard still talking about the grand class. So I told them they might as well come on in and sit down out of the heat. That's what you want in whatever you do. And thanks, Dr. Mullins, for talking about doing the grant writing class. And we do lots of events, but the events are not, just a minute, baby. The events are not to benefit the clinic or the patients program. The beneficiary is the community, and the community gains from that.
Right, BJ. I think I can add on to that as well, Maddie. Talking about how you build capacity for the community members. BJ does a great job of offering other resources for the communities to improve themselves, improve their well-being with the grant writing classes. When the holidays comes around, she gives one of the biggest turkey drives in the community. And Christmas time, she has a big tree and the kids come and they get toys and everything. So those events are non-project related. Those events are not related to a project that we have. So it's when you're talking about building capacity for your community members, yes, we want and would like participants in our community, clients in our community to participate in our projects. But again, that's part of helicopter research. We don't always go with our hand out. We go participate in their health fairs. We go participate in their events, in their community. So it's about building that relationship. When we build that relationship, that sustainable relationship, that's when the phone calls, the emails exchange, when we see each other out and about at other events, that they think of us and we're always thinking of them. So building the capacity for our community members is just like anything. We have a database where we reach out to folks with events that we have. We share a newsletter with them as well to keep them updated on our monthly events, weekly events, yearly events. And they also, that has I've lately been out in the community. That also has been a benefit, a huge benefit for us, because now when they see me coming, they say, "Oh yes, I know what you're ready to say. I know you have an event coming up. I know you have this project going on," because they've seen it somewhere before. So giving community members opportunities outside of our projects, or giving them a platform outside our projects, is part of that building the relationship and sustaining that relationship.
Rodney,
And
Jeannie has a
Rodney,
question. How can community engagement extend beyond one community to another and sustain itself over the years? For instance, how do we go outside of Baltimore to another city? And I would add, not just a city, but a rural area of Maryland or another state. How do we extend beyond one community to another and sustain itself over the years?
Great question, Jenny. There are a couple ways. I think the first way I like to address that is basically we find ways to meet the community where they are, right? So we not only right now we're doing this social online, and everybody's connected virtually for particular reasons. We know that this is what this class called for us, but we go out to West Baltimore, we go out to East Baltimore, we extend to Salisbury, we extend to the University of Maryland Eastern Shore, because we have built those relationships with those community members, those stakeholders, those professors, those principal investigators in those communities. So now they can speak to the patients program, or they can speak to what we do, and kind of give an introduction to who we are. Once that introduction is set, that's kind of like, that's all we need. If you give anybody on our team in the patients program an introduction, we have an opportunity to make that relationship stay, to build that contact. So that works for us really well here in West Baltimore, and it's gotten a lot better outside of West Baltimore. So that's a model that I'm pretty sure we're talking about a lot in the PPA, and hopefully you guys are picking that up, because that can work in other rural cities, other inner cities as well. About, again, connecting and sustaining. That's key. And you always have to have an open ear. The helicopter research, or going in one-sided, you have to understand what that community needs, what they're going through, how that community is built, who are the leaders in that community, and talking to them, having those genuine, honest conversations. And BJ says it a lot. If she can't get it, or if she don't know it, she'll find a way to help you out, or find someone who can. And we take that adage on as well here at the Patients Program.
And let me say this. One of the things that all of you guys are learning something new, but each of you have your own niche in what it is that you do. Multidiscipline is important. Everybody brings something to the table. Utilize that. Let that grow. Because I will give you a perfect example. Sunday, I did a health fair, and the pastor sent one of his parishioners over who's planning an event. And he told her, ask BJ. I bet you she knows a lot of vendors that will help. So she sat down. I told her to record it, and popping out of my head, I made sure that every service was represented. And I said to her, send that to me. I will do the introductions and send you that information. It's not what BJ done. It's what the Patients Program has brought to their event. And that's what I did one yesterday. So that is very, very important. That is capacity building. You become the bottom block and people build on top of you, but you are the bloom, you are the flower. Just open up and allow them to grow as you grow.
The next question comes from Sandra, who wants to know, do you seek to engage as many communities as possible, or do you identify them based on the research needs?
Sandra, great question. I mentioned to you earlier, I think that goes along with our engaging early and engaging often. So we try to engage. Originally, the Patients Program started out engaging the West Baltimore community. That has definitely grown since I've gotten here. So we engage communities that want the Patients Program to be a part of that community, but also we introduce ourselves to different communities because we want to learn about everyone. We want to learn about all communities. So there are some that are project related, but again, that goes to that going in one-sided. For example, if we get a project coming down the pipe and they're looking for older adults over the age of 45 that are African American and live in a senior home. We have a resume, or we have a Rolodex of folks and stakeholders in the community we can go to for that. That's for sure. But also, if there's a community fair in East Baltimore that is catering back to school events, or they're hosting an event where they're talking about improving relationships in the community, we attend those events too, because we want to be a part of that. We always trying to learn as much as we can about what's going on in our community. So they are research for our research needs, but they also have an opportunity for us to learn something new, learn something different, learn a different approach. Yes, we're there.
Rodney, can you also remind them about how we participated in the cleanup event several years back?
Yes. Great point, Karen. Several years back, there was a candidate here in East Baltimore, in Baltimore, that was given opportunity for volunteers to come out and literally help clean up the neighborhood. When I say help clean up the neighborhood, that's exactly what I mean. On a Saturday morning, Karen and myself, a couple of our volunteers, put on some sweats and some sneakers and gloves, and we grabbed a broom, we grabbed a rake, and we made a conscious effort to literally go out there and be boots on the ground at this particular time, hands on the ground as well in West Baltimore community. And what that did for them is show them that, hey, we aren't on this platform, or we aren't just downtown in these tall university buildings just doing our work, sit behind the computer. We want to come out and meet you guys. We want to come out and help make your community not only look good, but also learn a little bit more about you. And that let me know that, the leader of this organization, the leader of this recreation center, was just as nice as the neighbor on the corner who was literally instructing us on how to clean up his block, because he does his block a certain way. He know what's going on out here, know what the city initiative, but his block has to be cleaned a certain way. So, yes, Karen, that's right. So, we find ways, again, that's, if you want to talk about meet community where they are, that's as close as it gets on a Saturday morning, giving up your time doing that. So
some of the feedback we've gotten is that people want to hear some specifics. So, back to Sandra's question about, do you go out to many communities or based on your research? For you in a day, when you're behind a table at a health fair, how did you balance? What does that conversation start like when somebody walks up to your table? Because I think that gets into the specifics. How does that work?
I'll go first.
yeah.
So for me, so we had a few events this week. For me, I like to be approachable. So basically what I like to do is I like to kind of gauge how that person is feeling. Some people you can tell if they don't want to be bothered. And then there's some people who you can tell they're going to have a long conversation with you. So for me, I usually greet people. Hey, how are you doing? How are you enjoying the event? And then I share what we have on our table. So our resources, any events we have coming up, talking about the project. Another way I do it is I say like, hi, are you from the community? Because I'm not from the community, so I'm still learning. So that's an opportunity for them to share with me like, yep, I've been here for 20 years. And, some people go into a whole thing, but it's a way to build a relationship with that community member. It also shows that you care. Because oftentimes people are just like, oh, they're just about to give me a bunch of papers. I don't really care. But if you like kind of ask them questions and, stare away, like, you'll still go back to the project, but like, just, talk to them like you're a friend or just a neighbor down the street. I think they really appreciate that. And they remember you, because this week we went to one event on a Tuesday, and then on Wednesday we met some of the same people we saw, and they remembered us right away. So I think that just relationship building, not only just pushing your project, but just building that relationship with the community member has a really good impact.
And to add on that, I think, we do a great job of finishing the deal, so to speak. So after we give them the spiel about who we are and what we do, what particular projects that we have going on, why we're here today, they'll share with us that they had a long day and they're tired, and they'll share with us that their dog is in the car and they wish they could bring the dog out to enjoy the event, but they can't because the dog would get loose. We, again, entertain, listen, everything, all of that. But the key thing that we do is we want to let them know that we want to stay connected with them. So we actually have them sign up to be part of our newsletter. If they're interested in a particular project that we have going on right then, we'll sign them up for that project. So we'll give them all the information that we have on us. There's our phone number, there's our email address. You can check us out on social media, because we've understood that through our engagement, a lot of people learn and understand information differently. I can go to one event and I can give a flyer out, or I can give a pamphlet out, and I can tell they take it, put it right in their bag right away. But if I tell them you can go on our website or you can go on YouTube and literally check out the patients program and see some videos of us interacting with our community members, or see some videos from some testimonies from other principal investigators, researchers who work with us, they can internalize that information. So again, we find ways to meet them where they are, see what their needs are, what's going on with them, share our projects and opportunities. But you know what? Let's talk again. Let's meet again, or we'll be here next week. So that's important too about closing the deal when we do engage out and about in the community. That's very important. You got to stay connected and be accessible.
No, I agree 100%. I do community engagement. Actually, it's been 8 years now for Blue Cross in Chicago. And I just dropped a link in the chat of our annual community care fair that we host at our Blue Door Neighborhood Center. And so we partner with, in this case, the National Pan-Atlantic Council. I'm a member of Delta Sigma Theta sorority. We are, all of the Divine Nine organizations are committed to volunteering. And so every year during open enrollment, we host what we call our community care fair. We invite the Divine Nine volunteers to come out and help us distribute fresh fruits and vegetables, turkeys, because it's always the week before Thanksgiving, and they love to do so. And so being able to have a location in the community, our community center, our Blue Door Neighborhood Center, but also providing what's necessary for families to sustain for the holiday, and then also making available the COVID vaccination, flu shots. We even had children's winter coats. So if you have opportunity, I dropped the link in the chat. I'm in the video, not very many of them do they feature me, but just thought I would share that because it definitely puts you in the mind of some of the things that we're doing here in Chicago. And I'm really excited about the work you're doing in Baltimore and looking forward to maybe an opportunity to visit sometime soon.
You're always welcome. You're always welcome.
Yeah, thanks, Marie. And there's been quite a few questions kind of coming on this kind of central point of, how do you decide, one question, what criteria outcomes are you looking at to consider a particular research project as being beneficial to the community? Another one, does your community engagement drive the research project or the research drive the community engagement? And I think we've been talking about that, if you want to kind of emphasize that point of one is coming before the other. And
I think that's a good question about the one coming for the other. If anybody has the opportunity to hear Dr. Mona speak, or when he talks about the patients program, he lets researchers know that you can't come to us in the 9th hour, or you can't come to us in the 9th inning when you want to complete your project, and you need X amount of participants to participate in the study because now at this particular point you're short. He probably will say it in the nicest way possible. That's not something we do, but in order for our efforts not to drive our research not to drive our efforts, you got to come with the patients program right from early on, right from the beginning. So Ms. Morales, Karen is our supervisor, and she may sometimes throw a little hint out, say, hey, something's coming down the pipe, and it's about this topic, and it's about this. So we know early and often that, okay, next month or so, or 2 months from now, we need to go out and start, engaging these type of communities, building these relationships, or let's reach back out to those people who we already have connected with, who we already have engaged with, to let them know there's something coming down the pipe. So we're well prepared when it comes to community engagement for our projects and for our events in general, because we go out a lot and try to go out as much as we can now that we're back out into the community here in Baltimore. And it's all, number one, to engage the community, to let them know who the patients program is, to let them know that we're here and we will come back. We're here to stay. And also, you know what? There could be an opportunity coming down the line, because that's key for both parties involved, because we want the researchers to know that they can come to us and we can get the job done, but it has to be done the right way. So by us knowing early on when the project is coming, or maybe getting a little hint and then knowing when it's coming, once it's time to start, the ball has already been rolling with us. BJ has already been rocking and rolling with getting people lined up. A day has already been rocking and rolling with making the calls and getting our schedule together to make sure that we know where we're going to be. just this past this week, we're preparing for an event that we got coming up, Patients Day. We had to double dip sometimes. So Ade and some volunteers on the team, they were at one event. I was at another event. So BJ's on the phone calling, making connections. So it's a team effort. All duties is, all hands on deck. And having that approach, meaning letting people know that you can't come to us at the end or not even in the middle. You got to come with us in the beginning. That helps us a lot. Make sure that when we're out and about the community, we let them know that, hey, there's an opportunity for you that could benefit you and the community that you live in and the people behind you, be quite honest, family and friends behind you.
Thanks a lot, Rodney. And yeah, I think, for those of you that are in the Patients Professors Academy, kind of after the academy, this idea of, so we have this large group of people that when there are research opportunities coming along that people can get involved with, like, there are ways for us to say, the engagement's been done. They're a group of people that can choose to be a part of whatever project might be coming along. And, and I think Ade and Rodney, I was at the event on Sunday, they made a really good point, and this topic came up in the office hours yesterday, another discussion we had about calling something research. So Ade and Rodney said, it's, sometimes we say it's like non-clinical research. We're not talking about doing, blood draws, whatever it might be, but it maybe, giving feedback about a recent health initiative. Did it work? Did it not work? So it's not always, I'm not sure the word, and not, like hard research. I don't like that word, but it's more like, wanting to do interviews or focus groups about particular things happening in the community. So.
Yeah, Joe, I think, early on when I started here with the Patients Program and once I knew what the role was and what my responsibilities were and out and about in the community with BJ, and I would go out and I would lead with Rodney, Elliott, and folks here in Baltimore know me from a different background. So when they see me, they automatically think basketball and, what you got going on. Are you coaching? And I'll entertain those questions here and there. But lately I've been coming out there and say, hey, that's the old basketball player who now is in community engagement. So I like that. That's good. It's fine because I'm not playing basketball anymore. But when I first started, and I'd start off my spiel and Rodney Elliott, engagement specialist, University of Maryland, the Patients Program, and we do research. Immediately when I say that R word, some of our community members would kind of freeze up a little bit and they would back up away from me a little bit. And I said, okay, well, I need to find a different way to deliver it because I don't want to shy away from it. Yes, we're doing research, right? But here in Baltimore, there's been a stigma behind that R word, research. So we've found ways to say who we are and what we do and let them know that what happened in the past has happened. But in order for things to change going forward, we have found ways to connect with our community members, connect with our stakeholders, and let them know that we're not saying that what happened in the past to some of these communities when it comes to research was right or we're ignoring it. But we're always trying to think ahead and think progressive and give folks the tools that they need to make smart decisions. So when they get information from us and from Ade and I, we're out and about on our table and we get them health related information, that helps fuel their hunger to learn a little bit more about the community. When they attend the sessions here at the Roundtable, or when they listen to Real Talk with Rodney, or when they, be quite honest, pick up the phone and call Karen and ask her questions about project, that's giving them information, education, they can make a sound decision. So now they can have a seat at the table when it comes to improving their health community, improving their overall health equity as well.
There's a series of questions also in here about, if we're designing a study, so for instance, Shoba asked, what criteria or outcomes are you looking at to consider a particular research project as being beneficial to the community? Others want to know information about, as we're starting out, how that works. I know, Karen, you're probably more involved in proposal development. Also, Mike Scott offered as an advocate who has observed and worked with us in that process. So maybe starting conceptually with you, Karen, and then we want to give Mike an opportunity to talk about his experiences.
So in terms of projects, and when we're in the process of developing projects, we're seeking to what will benefit the community. We've heard from our community partners about things that are important to them. So when we're seeking to develop, we actually have what's called a co-driven. You may have heard from Michelle recently. what's co-driven is a PCORI project, and I spoke about this the other day as well. But PCORI was looking to hear from community members. So when we developed that project, it wasn't because we wanted the funding, it was because we wanted to seek out what the community wanted to hear. We wanted to give back information to the community that would be beneficial to them. So when we're seeking to develop a research project, we do look at investigators. We do hear from investigators who want to work with us, but we don't always accept their projects. I'll tell you about when COVID hit. I don't know if Daniel has talked about this yet, but when COVID hit, many researchers wanted to start developing projects around COVID immediately. And the patients program, as is our custom, Daniel came to us and he told us that a big official person on campus wanted us to participate in a COVID-driven project. And we as a team, we didn't know much about COVID. No one did, right? So our concern was for our community first. So because we didn't know about COVID and we weren't sure where things were going with this, is this just an opportunity for more research? Is this, on the backs of communities? And we said, you know what, we have to pause because we don't believe our stakeholders would want us to jump into that immediately. So well, I don't want to say unfortunately, Daniel had to go back to this high official and tell him that the patients program was not going to participate in that particular project at the time, and we didn't. So I think when we're looking at projects, and I've seen this actually happen over time, when we want to work on a project, it has to be something that we believe is of the interest of our community. It's going to benefit the community as a whole, the community at large, and not just the research of University of Maryland. Of course, we want to promote people's projects, but we also want to do what the needs of our community are. So that's how we kind of focus our drive or what it is we're going to do. We don't just jump into any research project. We do consider how it affects the community. Will the community benefit from this? Is there something that from our stakeholders we've heard about this particular topic that they're interested in? Some of our community leaders, we have right now, I don't know if we've talked about this so far, but we have another project with Mount Lebanon Baptist Church right now, and it's called Commit, and it's actually an opportunity for CVS and Mount Lebanon to partner together and develop opportunities for people in the community to build sustainable futures for themselves with careers, with positions, and their health. So again, we're looking at opportunities that benefit the community, researchers, and everyone collectively.
So I have to give you a little bit of background before I explain what we try to do with the patients program as quick as I can. For nearly 40 years, for complex reasons, I have been educating physicians, patients, spouses, you name it, about what happens when you get diagnosed with prostate cancer and all of the potential ramifications that are related to that. Something like 20 years ago, a number of physicians who got themselves in all sorts of terrible trouble started to suggest, partly at my pushing, that there were an enormous number of patients who got diagnosed with prostate cancer that was never going to kill them or was never going to metastasize. It took a while to prove that. And about 10 years ago, we finally proved that something like 40% of all men who get diagnosed with what is now known as low-risk prostate cancer don't need immediate treatment at all. This is a huge, big deal. And among those patients, I started to talk to people who and say to them, so this changes the nature of research about what needs to be done for you. Because yes, you are still at risk for progression, but the issues of your quality of life and the anxiety that you are suffering from living with the disease, because you have to have continuous tests every year for years, and most urologists still want to be giving you a prostate biopsy every year, we need to rethink research in this space. And I talked to a number of people about this. I mean, specialists in the field of prostate cancer patients themselves, the AUA, the American Urological Association, and others. And I had recently met Daniel. And finally, I decided to bring all these people together in a little meeting, or as many of them as I could. We all agreed we would try and put together a grant request to PCORI to put together a meeting that brought patients and specialists together to talk about this particular research need. It took us 3 years to get the grant, Daniel, is that right? We screwed up the first time. We did it right the second time. It took us a year to do the project. We got an awful lot of information out of it, and we are now in the process of starting to disseminate that information more widely. I think I said this to some people the other day, but I mean, this was an example of me getting lucky and meeting Daniel, because I would have had no clue how to get a grant like this. I knew it had to come from PCORI. I knew PCORI had all sorts of weird and wonderful rules about what they would and wouldn't do. It would have taken me a year to work out how to even talk to the right person. And I figured Daniel would be able to help. I'm not quite sure what Daniel's reaction was to all of this the first time round, because he'd never worked with what is, I mean, I run what is basically a global patient advocacy organization. It's not big, but we provide information to anybody who contacts us. I don't care what their skin color is, what their age is, anything. And we try to provide them with information that is catered to their situation. And there are people who are so terrified of cancer that they can't hear a word. And then there are those who've read 400 articles in the past month. They think they know the answer to anything, and they've got half of it wrong. What we are trying to do is basically build an utterly new research initiative within the urology community, because prostate cancer is the biggest money-making factor for most of the urology community. 200 and something thousand men in America get diagnosed with this disorder every year, and every man who gets it is terrified. Well, 99% of the men who get it are terrified. So it's a complex situation. I think we got a decent result out of the actual symposium that we held to discuss all of this, which had to be done virtually and had to be done over 3 days. But we're really only at the beginning. And I mean, I need you to understand that in putting all this together, I've told everybody from day one, this is a 40-year research project. And it involves thousands of different communities. And I work with other prostate cancer advocacy organizations that have support groups all over America. I've worked with the Prostate Cancer Foundation, which is extremely focused on advanced prostate cancer, not on early stage prostate cancer. I have fought with some of the researchers who still think that everybody who gets prostate cancer should have their prostate removed immediately, regardless of the sexual consequences. This is a sort of, from a patient advocate point of view, this is a sort of project where I see the input of the patient as being critical, because the patient wants to know, one, can I prevent myself from getting prostate cancer at all? Answer, no, not yet anyway. Two, if I get diagnosed, what do I need to do? We know a lot more about that than we knew 20 years ago. Three, if I decide not to have treatment, how do I manage all my anxiety and all of the other things that affect my quality of life while I'm living with a cancer that is growing in my body? And it is growing, but it's growing very, very, very slowly if it's low-risk prostate cancer. Complex problem. No one community to deal with. The community of the researchers is further behind than the community of patients in thinking about how to handle a lot of this. Is that a fair summary, Daniel?
Ms. BJ, did you?
Mike, great work. but I want to throw something in your pocket. I was Dr. Mullins, and I'm going to tell on him, dragged me out of retirement to work West Baltimore Black churches. I did a project called Project Heal, where I taught across the board all of the cancers to parishioners. Each minister could choose 2 to 4 parishioners for me to train. I would train them and certify them where they were called CHARs, Community Health Advisors in Cancer, where the pastor has just that much time to spend with a parishioner who's in pain and crying and upset. My CHARs could spend that much time, sit with them, rock with them, cry with them, go with them to the doctor. That's what Project Heal did for our churches. And it was so good that we did a retraining after COVID, because we want our CHARs to keep their hands in this and to continue to do this. I am their resource person. So not only do they have manuals, do they have PowerPoints, do they have booklets? I've actually taken Dr. Mullins' project to different states and presented it to full faith, like the Apostolic Church, which is like 1,200 strong in a conference. And I came back with more little notes. Will you do it in this place, that place, and the other? But it's our program here. But you're doing a great job. But I think that if you look up our Project Heal and see how you can get more out bang for your buck, because not only did I teach ministers, I felt that the parishioners are the ones that had the time, and they understood that what they heard, their mouths are shut. Confidentiality was a big session that I did.
So Barbarajean, I mean, that's also great work, and I think there are 2 different things going on here. My task and my goal was to work out what the most important research was that we needed to do to improve, to be able to find out how to improve the care of a specific subset of prostate cancer patients. The education, I mean, I do education as well. That's a separate issue. And there's a guy up in Boston that runs a big prostate cancer group very specifically for the African American and Black community. And we tried to work with him to help us with this project, but he had a lot of things on his plate at the recent time. I mean, all these things do come together in different places, but I think that what I'm trying to exemplify is that there are different types of project, educational projects, true research. I mean, this is big research at the most basic level that needs to get done, that has not even been defined yet. That's the piece that
I'm going to jump in just because I want to make sure that we have time for the other questions. Sure. So one of the interesting questions came from someone who's experiencing a challenge in her workplace, who asked about, at her point, that they're having significant turnover. So Elaine says, my local hospital system is severely short-staffed. Are you experiencing short staffing? And if so, how are you handling it?
For us here at the Patients Program and Engagement Team, we have an enormous amount of help from our other student volunteers here on campus. They come out and help us out a lot in our engagement efforts. They volunteer their time. I can send a call or email to some of the teammates here. So we haven't necessarily experienced that, which again, it afforded us the opportunity, like I mentioned to you earlier, to really double dip on the same day. So in the summertime, when events are happening right now, we feel comfortable enough that we can go to 2 events on the same day and still have that same impact. Some of the resources that are reaching out to us for our services or for our knowledge about research, we let them know that, hey, we may be 2 people here, we may be 1 person there, or we may be two over here, one over there, but we will find a way to get it done and stay connected. So we haven't experienced that, particularly with the engagement team. We're growing over here at the Patients Program, so we still find ways to stay connected, and we just find different ways. You know, we do stuff virtually. During the pandemic, we actually had an opportunity to figure out ways to still engage folks via focus group online. So that was kind of successful for us for a short moment of time, but it was a blessing because one particular event I remember that was just so awesome was there were two older adults living in the same building that didn't know each other at first, but they participated in our project. They participated in the focus group virtually online. Before that, we had to make a couple calls and talk to them about how to get online, how to get an email, how to work Zoom. That was different for them. Again, older adults. So they participated in the focus group. It was very engaging. They found out during the focus group they lived in the same building. So what they did was they actually started a weekly or bi-weekly get-together via social media or via Zoom because they were quarantined in their apartments. And as we all had to, social distance and we all had to stay at home and quarantine, there was a thing that BJ talked a lot about during that time for the older adults where it was social isolation. And that affected a lot of our older seniors, our older adults in these communities, and they were at home alone and they didn't know how to use technology. But we had the opportunity to actually teach some, and it warmed my heart and it warmed our heart as a program to know that Ms. Johnson not only participated in our focus group and, she shared their experiences and, she got a gift card that was great. But when I called her back to check on and see how she's doing, or let her know what other project we got on, she let me know that she's been staying in contact with her grandson or her granddaughter over FaceTime or on a computer. So we haven't been short-staffed. We just still find ways to navigate and still try and find ways to connect with our community members.
Thanks, Rodney. Jayashree wants to know who are the community partners of the university and how do we add more community partners? Maybe we can start with Karen talking about the different levels of partnership, the difference between being on our executive steering committee versus an individual project versus someone we just keep in touch with, and then maybe go to the rest of the team for some specific examples.
Sure. So I want to start out by saying, we have this thing called Big P Partners. And so those were the official partners. So the Patients Program started out with an external advisory board and an internal advisory board. So the internal advisory board was made up of many physicians, social workers, nursing staff, people from all over the university, different departments and schools of the University of Maryland when the program first started. So they were all interested in the initiative of what Patients Program was doing, and they added their input. We said, okay, we need external. It wasn't then; it all started at the same time. We needed external stakeholders as well. So you had the internal, and then you had the external stakeholders as well, who came in, and they were external, and they became one leadership team. So now we don't have an external and an internal. We have our advisory board. So they actually tell us or give us guidance on where we should be going. Again, as I mentioned earlier with our projects, where we don't do anything without coming up with a go, no go decision as to whether or not this is a patient-centered project. Our leadership, our steering committee also determines the direction that the program is going. And those leaders are physicians, and they're also community advocates working together, community leaders working together. So it's not just leadership from the University of Maryland, it's leadership from the West Baltimore community and beyond who are actually steering the way the Patients Program goes. So
and
I
just
love that.
Jump in to add, because I think that our shared governance is really critical here, Jayashree and others. By our operating procedures, when votes are taken, we make sure that our steering committee always includes more people who are from community partnering organizations or community leaders themselves, as opposed to University of Maryland employees. So our it gets to decide whether or not after grant, if the community partners disagreed with us, if it was kind of unanimous and externally, external groups can outvote us. And that did happen in some cases, but as it turned out, it wouldn't have mattered, because anytime our external partners in numbers didn't agree with something, the same vote came out of the internal members as well. And so it's interesting
Okay.
how the external partners have educated the faculty at our university, and faculty will not do something if it doesn't appear to have benefit to the community. And so that's a really nice example of bidirectional learning, where we set up a structure
Yes.
that the community could keep us honest, but then our own faculty learn that process and they themselves vote against things that don't appear to have benefit to the community.
Okay. That's
engagement
wonderful.
in
That's
terms of-
wonderful to hear.
Some of the specific partners that you engage, you talked about some of them, Rodney, but you want to talk about some of the partners that, we work with.
Yes, thank you, Dr. Mullins. Yes, some of the researchers or principal investigators who we worked for in the past are our partners, right? So we reached back out to them for, I actually reached out to one recently who we worked out with to give me a quote. So I want to get his opinion for, how he enjoyed working with us. And he shared that with us. That'll be published in another publication for Outpatients Day coming up. But one partner that I'm developing a relationship with right now, or we are developing a relationship now, is the director of the CEC, the Community Engagement Center over here at University of Maryland. That's a center that's literally 2-3 blocks away from the university, in the center. In the community, in the West Baltimore district. But they also have resources that are for the community, but also for our university. Just yesterday, we were there at a lunch giveaway. They had free lunch for the community. Anybody could come by and get a lunch. So you think about a recreation center, so to speak, in the West Baltimore community, giving away free lunch. Everybody comes in. Neighbors, 2-3 blocks away. There's a senior home not too far away. Some of the seniors there. It was interesting to see some doctors and students come over there in their scrubs to come get a free lunch, right? So that to me says that they are connecting with everybody in their area, not just the community, not just the researchers. They're building those relationships. So when we find out that that's a stakeholder, I found out that that's a stakeholder that I want to be a part of, that we want to be a part of, because we know that that's a hub, so to speak, where people come to enjoy resources, free lunch. They have senior classes. They have summer camp for the kids. They have a STEM class there that, they have an early engineering class for some kids as well. They have a culinary option as well. So they're giving tons of resources for the community. And we are not the only institution, meaning the patients program, that also helps out. They have nurses that come over there sometimes and, take blood pressures, things of that nature for the community. So you finding people or finding organizations in your community on campus as well as not too far, that helps. Again, that builds your capacity for your community. That builds your impact. That broadens your space to stay connected with community members.
How about from BJ and Ade? Like, can you give examples of organizations that you go visit, places where, when we are able to go into the community, where we do our work, where do we have listening sessions? Where do we, do focus groups, to give examples of some of the partners?
I will just piggyback off of Roddy and just say that our connection with the Community Engagement Center has been phenomenal. So in addition to connecting with the director there, she also connected us to 7 other organizations within the community. So that's an opportunity for us to build those relationships with 7 other community organizations. So just building that relationship with her has been a plus. Attending events that she's invited us to has been a plus. And now we're about to connect with 7 other organizations, which is a plus.
And I also want to say, don't underestimate being visible. Don't underestimate being as visible as you can. Don't underestimate connecting with your community. Joining health fair or taking a walk around health. You don't necessarily have to have a table. Everybody here knows somebody that's a stakeholder in their community. Everybody here is connected to somebody, and that's important to realize.
Okay, can you do like you do at the end of some of your shows, a bulleted list? I know you've been to one of the libraries. I know you've been to a couple of the barbershops. I know you've been to several churches. BJ's been to many churches. Can you kind of go down a list of, boom, 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 boom? You
mentioned barbershops. There's cafes. There's senior homes. Like I said, senior residents have hours where they have movie night. I just got invited to a movie night at a senior home to join them for a movie night. Those are things that we're all available for. Barbershops. Joe mentioned that. Joe put a question in let me make this statement. I don't want to let everybody know that we hit a home run every time, that we connect with a community member every time. That's not the case. There was an incident where I tried to reach out to a barbershop owner, and talk to him about what we're doing and what we got going on. And he wasn't necessarily sure about it. Again, that whole R word, the research word. I've since stayed connected with them. We still exchange emails, or I'll see him out and about in the community. But, I'm eager to figure why he wasn't so easy to, or why he was, hesitant for building a relationship with us. That doesn't necessarily, steer me away from still trying to stay connected, right? So, when you hear a no or you sense some hesitancy, go back, regroup, and figure out how a way to stay connected. But always, always stay authentic. I think that's the key, because BJ mentioned it earlier. The community members can definitely tell when you're not being authentic, and being patient. Being patient is key as well.
That's wonderful to hear. Thank you all.
Thanks a lot, Rodney. Yeah,
Great
it's,
discussion.
yeah, it's a lot of it is, and what you all do is being in the community, actually being there, being visible. So yeah, in my experience of doing that too, it's actually showing up and doing what you're, doing what you're supposed to do, but also exceeding that. So.
And Joe, I want to. Are we getting ready to close, Joe?
Yeah, sure. Yeah, whenever. Yeah, if Ade and Ms. BJ and you, Rodney, have any closing thoughts about community engagement for the audience, yeah, would love to hear it.
I do. There was someone asked a question about how you can participate in or know what the patients program is doing. You can check on our website. You can email Joe with your email. We can add you to the newsletter. There's tons of information out on the patients program. If you want to come volunteer with us out one of the events, or you can also know where we are going to be when we're out in the community. That's always fantastic opportunity. Guys, I have a background in playing basketball, and a lot of my inspirational quotes come from a lot of my coaches I've been part of. And one of my favorite quotes came from an Italian coach I had years ago, and he was one of the hardest coaches I ever played for, just really intense. But he told me, it's not the strong nor the smartest that will survive, but the ones who are willing to adapt will. That made all the sense in the world to me back then, because I was having a real hard time adapting to his approach to how to play the game. I knew it all. I knew how to put the ball in the basket. I knew what the offense was running. I knew what defense was, but it wasn't working for that team. It wasn't working for that moment. When you're out and about in the community, or when you're engaging with these communities, you got to learn how to adapt. Because when you adapt, you're learning something new. For me, that worked from my first year here at the Patients Program to my 5th year now. I'm learning. I'm adapting along the way. I will continue to adapt. In that moment of adapting, I think that's the opportunity for growth. That's an opportunity for discernment. That's an opportunity for, listening with a purpose, not listening to respond. Those are all tactics that help me out. So if there's a private investor a principal investigator out there, if there's a community member that wants to get a little bit more involved on this call today, figure out how to adapt, and I think that will help you along your process.
Last thought, you guys, for those who are in Baltimore, please do come to Patients Day, August the 16th, 10 a.m. over at the CEC Community Engagement Center. Please join us.
Yeah, Ade or Ms. BJ, do you have any parting thoughts?
No, just to piggyback off of Karen, I did put the registration link in the chat. So anyone interested in attending, just go ahead and click on that link.
All I want to say is just bring yourself to the community, cultivate your relationships. That's what the building blocks are all about. And when you do those things, when you step up, your community will step up. And I want each of you to remember, this is something I say all the time. I am the conscience of the Patients Program. I am a community advocate. And what you do is based on the community itself. You never could do what you're doing by yourself, whether you're doing research or you providing education, or you just want to take care of someone else. You cannot do it alone. And please, I've been out here a long time, and no, I do not know everything. My coworkers think I do, but I don't. Because of the fact that you learn, you allow yourself to cultivate yourself through your community and vice versa. Good luck, all of you. You'll do very well.
Beautiful.
Thank you so much, everyone, for attending and participating and asking questions. I really appreciate it. I put a link in a little bit up the chat there of where you can see the recording of this and all the other recordings of the Roundtable series we've done this summer. But again, thank you so much for participating, and with a lot of great resources. I will send out some of the links from today and from some of our other meetings this week, so people have those to keep engaged and connect with what's happening here in Baltimore, but also resources you can use from wherever you are. So thank you so much.